Alrighty, everyone. Good morning. I do apologize for the delay. We are having some internet issues, so I am going to get us started. I am just going to open up. Good morning. I do apologize. Getting a little bit of help. We are having some internet issues, so sorry about that, and I do appreciate everybody's patience. Sorry for dropping you all. All right, so good morning, everyone. I want to thank everyone for joining us again for our second Facebook Live stream. We are very, very excited to be able to provide this as a constant update, a way to engage with our families and our friends here at the community. I did not get as many questions as I did last time in advance, so I'm going to start off just providing a little bit of an update here on campus and also maybe addressing some recent communications that we sent out. So first and foremost, we are once again very excited to announce that at this moment we are still completely COVID-free. Again, I want to repeat that. At this moment, Aviva is still completely COVID-free. That means that we do not have any residents or staff who have tested positive for COVID-19, as well as we do not have any residents or staff under investigation for COVID-19. So that remains very exciting, especially in light of the recent listing that the Florida government released of facilities. Many of them are our colleagues and friends, and our thoughts are with them and just hoping that they can get through this as best as possible. The other thing I wanted to address, as people kind of log on and maybe start getting some of their questions together, is reopening. I know that reopening has become a major topic both across the country and here in the state of Florida. As many of you saw last Friday, Jay, our CEO and president, released a statement regarding reopening, and we stand by that statement. We will continue to stay closed, stay under the precautions and procedures we have put in place for protecting people from COVID-19, specifically protecting our residents and staff, until we feel it is safe to open in a way that we can keep people secure and prevent any kind of spread of infection. So what that means is we are going to continue our procedures and policies as they are at the moment. We know that the current order for nursing homes and assisted living facilities to stay closed is until early May. At that point, we will reevaluate and see if we can lighten some of our policies, but at this moment, with the current rate of infection here in Sarasota, we do not see that as a possibility. So as always, we will continue to keep our families and friends, up to date with information, and try to keep people as safe as possible. But again, I really want to stress that regardless of the decisions that some government officials, public figures, other facilities, we've seen the news that several beaches in West Florida are going to start opening over the next few days, but we feel very strongly that our decision to either remain open or closed is going to fully depend on the advice of experts and our medical professionals. So we of course understand the burden and the emotional toll this is taking on our residents, on our families, on our staff, but ultimately when it comes down to it, the most important thing we need to focus on is the health of our residents and staff and the families that our staff goes home to every night. So that is kind of where we are right now. I see that we got our first question. Great. Carrie is asking if Coburnick would have less restrictions before the Anshin building. The answer is most likely. The reason for that is that our Anshin and Benderson buildings fall under the guidelines of the state and federal government. The Agency for Healthcare Administration, as well as the Centers for Medicaid and Medicare, or CMS, are the ones that put out the restrictions and the guidelines for those levels of care. Independent living has been a major talk across the nation, especially with those of us who are in senior living, because there are really no legal guidelines. The Agency for Healthcare Administration did release some guidelines for independent living, but because they don't regulate independent living, those were more suggestions. With that being said, what does reopening look like for Kopernik? It will still remain probably very limited visitation. We will probably still limit communal activities and communal dining. And really the biggest change will be if we can have some kind of opening of things like the fitness center, the pool, in very limited time frames. People may have to make reservations to go to these things. Same thing with dining. If we were to open it, it would be, there would be various seatings, and there would be, you would have to make a reservation so that we could limit the amount of people in the dining room. With all of that being said, we have no plans at this time to consider a reopen strategy for any of our buildings. We just do not feel like it is currently safe to do so. Our opinion is that we need to see a decrease in the number of cases in Sarasota for at least 14 days before we consider any kind of reopening. That is actually a plan that was outlined by the federal government. It is the same plan that many governors are looking to understand in their states, and it is a plan that we feel is really confident in protecting anyone. Richard, yes, that is a great question. Has anyone had staff help using FaceTime or equivalent to contact a resident in memory care? 100% yes. We have the capabilities to do FaceTime and Skype in all of our facilities, in all of our levels of care. Richard, for you, all you would need to do is go ahead and call over to Anshin and ask for Ellen Frank, and I will post her information after this video just in case anybody needs it. But you can just call the main number and ask for Ellen Frank. She's our life enrichment coordinator. She's heading up the operations next door in terms of activities, and she can get you on her schedule so that you can FaceTime with mom and Skype with mom, when it's convenient for you, as well as when we have staff availability. I really, really encourage it. I think it's a great way to connect with family members. It's a great way to connect with our residents. And I hope that everybody takes the opportunity to do that. So again, if you have a loved one in our Anshin or Benderson building, all you need to do is go ahead and call Anshin, the main number at Anshin. And again, I can post all of these numbers on Facebook once we're finished, and ask for Ellen Frank. If you have a resident here at Kopernik or a loved one and you'd like us to assist in a FaceTime or a Skype, all you need to do is call the main Kopernik number and ask for Maria Leonardo, who's our Director of Life Enrichment. So yes, please take the opportunity to use some of the modern tools we have at our disposal. And Richard, I'm sure Mom would love to be able to see you and interact with you. So yes, please do that. Any other questions that we see coming in right now? Otherwise, I can go in and talk a little bit about some additional things that may have come out over this weekend that mostly apply to our Benderson skilled nursing facility. But one of the things I really want to stress is transparency. Again, there has been a lot of talk of facilities choosing not to release whether or not they have positive COVID-19 cases, whether or not they're testing, things like that. I really want to stress to everyone that Aviva has and continues not to plan on not being transparent. We have planned since the very beginning of this public health emergency. We have created a communications plan so that the minute we have any kind of testing or any kind of evidence that a resident or staff has COVID-19, all of our families and all of our residents will be immediately contacted. Families are going to receive an email communication, as well as for families that have residents in the immediate care unit. So again, let's say you have a family member in our Benderson unit and we have a COVID-19 patient, we are then going to call all of those families. All families across campus will receive an email, but the families that are going to be directly affected are going to receive phone calls, just in case. Residents, same thing. We're going to release, we're going to email them, we're going to send out letters. For those in our memory care and our assisted living who may not have access to the benefits of modern technology, our staff is going to go through the unit and explain to them what's going on. We feel that it is so important that we are transparent during this situation. The last thing we want is to add more emotional burden, more stress, and more fear to all of you, wondering, if your loved one is in a situation where they may come in contact with a COVID-19 patient. So we strongly believe in transparency. We fully plan to keep that going for the full extent of the public emergency crisis. And, that is very much our plan. Now, CMS has also released some guidelines in terms of weekly communication with residents of our Benderson Skilled Nursing Facility. We feel pretty confident that we have been communicating to the fullest extent that we can, using Facebook Live, email, and things that, and things like that. But we will be sending out weekly emails to our Benderson residents in coordination with CMS, as further just following regulation. So, nothing has really changed in terms of our procedure, but I did want to make people aware that, these changes have happened and we are following them closely. Greg, knowing the governor blocked some release of other facilities, do you know of nearby facilities who have any cases? We do. So Aviva is part of what's known as the Sarasota Senior Living Consortium. It's a collection of 11 facilities here in the Sarasota area, ranging in size, ranging in denomination, things like that. And we know that several of our facility neighbors, as well as our friends and colleagues, are dealing with a COVID-19 patients. Many of those have already been reported. You've no doubt seen on the news the Pines, Sunnyside, groups like that. So we are keeping very close contact with those facilities. I am really pleased to say that, our friends at the Pines and at Glenridge have done an amazing job in really containing that situation and have really been doing the best for their residents. So we are aware of other facilities that have cases. We aren't aware of any facilities, to our knowledge, that were not on the list that have positive cases, but we do have some further information into the extent of those cases. Sandra, in terms of cleaning protocol, so specifically here in Kopernik, all of our housekeeping staff are wearing masks, they're wearing gloves, they're sanitizing all of their equipment. In terms of, are they changing gloves between each room? Absolutely. That is really standard practice even before the virus, is, just changing your gloves before you go into a new room. Cleaning cloths, as we said, I don't fully know the answer to that question. I can definitely get some more information. Items from room to room that could potentially carry virus from room to room. At a certain extent, there isn't a full able way to sanitize equipment. For instance, I know that there's been some talk about vacuum cleaners possibly carrying the virus from room to room. We're still working on trying to find more research that actually proves that that's a possibility. Where cleaning cloths are being washed every single day as they normally are. The cleaning cloths are really only used to spread sanitizing equipment. But what we've really been recommending here at Kopernik is residents need to make the decision about housekeeping on their own, just as families are doing across the country. We are doing everything we possibly can to keep our housekeepers safe, to keep residents safe if housekeepers are coming in and out of their apartment. But at a certain extent, we really need to stress that if it is a concern to you and to your loved one, then it's best to err on the side of caution there and maybe have housekeeping no longer come into their apartment during this public health emergency. As I said, we're taking our guidelines from medical professionals who feel pretty confident in what we're doing. But I think, especially when it comes to here in Kobernik, there's a level of safety and sanitation that we have reached. I don't know if that can go any further than where it is right now. Now, moving to next door, where we're looking at our assisted living skilled nursing, the sanitation program and the sanitation process is completely different next door. In our Benderson skilled nursing unit, especially when dealing with patients who may be coming back from the hospital, which we are putting on precautionary isolation. Our cleaning staff is using gloves, they're using protective equipment, they are, changing from room to room to room. We're using medical grade sanitizer in those areas. The same sanitizer that we're using here in Kobernik, but we really are, paying a very careful attention to infection control across campus. So that is really important to us. But again, I really stress, if you have a resident here in Kobernik, you need to kind of make that decision for yourself. As I said, our team has not seen any evidence to prove that vacuum cleaners can carry the disease, the virus really. But, again, that's really going to be a personal decision. Carrie, are the nurses, CNAs, and Anshin being provided with new masks every day? That is a great question. And I honestly wish I had a more positive answer to give you. But the answer is no. Our staff in Anshin, in assisted living and memory care, have been given N95 protective masks, which they are keeping here on campus in brown paper bags, because that is what is being recommended by the Agency for Healthcare Administration as well as the CDC as a way to reuse masks. Why are they reusing masks? The simple answer is there is no way that we can have enough PPE, personal protective equipment, to give nurses and CNAs in assisted living and memory care enough masks to change every day. And unfortunately, that's just a reality that I think senior living facilities across the country are dealing with. Is, we don't have the equipment that we need to fully embrace what we would like to see as the infection control that we would rather have. There's been a lot of talk about cloth masks. Are they good? Are they not good? We feel pretty strongly that if you're not dealing with a COVID-19 positive patient, or if you're not dealing with somebody in isolation, that cloth masks are a great alternative. They can be washed every evening, which is so important. So some of our nurses and CNAs in Anshin are choosing to wear those. So we are really working on it. Carrie, can we help in any way? I so appreciate that. At the moment, we are doing our level best, I think, to get the personal protective equipment we need. We're working with the county, we're working with the state. We have been so fortunate to have some great nonprofit partners. I specifically want to give a huge thank you to the for AJAS, which is a Jewish specific organization for supporting aging services. I think it's the American Jewish Aging Services Group. I always get the name wrong. But AJAS has been amazing in getting PPE equipment out to their partners and their facilities. It has been extraordinary to see the ways that they are getting it. But to give you an idea of how quickly we are running through PPE equipment, on Benderson alone, we run through 9 masks every hour. With that in mind, we are really trying to keep our PPE equipment as preserved as we possibly can. We are building a stockpile here on campus of PPE equipment so that if it comes down to a moment where we do have a COVID-19 patient, PPE equipment can be released to the entire campus. Residents, staff, private duty aides. We're talking about full PPE equipment across campus. Because we don't have anybody under investigation for COVID-19, and because we don't have any positive cases of COVID-19, we are rationing our PPE equipment. So that is why CNAs and nurses on Anshin Assisted Living and Memory Care are being asked to reuse their masks. Same thing here at Coburnick. All of our staff, excluding our housekeeping, our maintenance, and our dining services, are wearing cloth masks, not the N95 masks. The 3 departments that I just mentioned, they are wearing N95 masks. So that is how we're kind of rationing it. As I said, I wish I had a more positive answer that kind of, I could say, yes, absolutely, they're changing masks every day. But we really need to think about rationing it so that if it comes down to us having a case here on campus, we can ensure that we're following the proper infection control policies when it comes to PPE. But if you can help anyway, that's great. If you happen to have a line on where we can get some additional masks, specifically the N95, we've been really fortunate to get quite a few cloth masks. We have a great group of volunteers who are making cloth masks for us. I actually have one here. I love it. It's a great mask. Special shout out to one of our own, Nikki Wisnowski, who her and her mom are actually sewing these for us. But if you happen to have any idea about N95 masks, then you can always shoot me an email. We'd love to kind of follow up on that. So, does anybody else have any questions? I'm just kind of reviewing over here our little questionnaire thing. In terms of masks over at Anshin and Benderson, we are also using surgical masks, which I think are really important, especially, as I said, when dealing with non-COVID-19 patients. The surgical masks have been proven to be absolutely successful. They're easy to be disposable if needed, and we've gotten a really great stockpile of those. So I actually just got a text message from Teresa Martin. Teresa Martin, our Vice President of Healthcare Services, to remind me to say that we are using surgical masks for those staff members who are not dealing with any patient in isolation. As I said, we are putting residents in isolation if they return to the hospital. If they return from the hospital, please. I'm sorry about that. If they return from the hospital, we are asking them to isolate for 14 days. At Benderson, we have a isolation wing that we have kind of created for ourselves in case we need to. So that's kind of our process right now. Sandra, I'm sorry to say last night my parents saw independent aides in the halls not wearing a mask. What should a resident do if they see this happening? How can you enforce that? So Sandra, when you say independent aid, I'm going to assume that you mean a private duty aid. And that is something that we are dealing with on the kind of emergency management side. To give you an idea, we have about 51 private duty aides who come into Coburnick every single day. We have been really thankful to see so many of them are following proper procedure. They're wearing masks, they're using gloves, things like that. If a resident sees somebody that is not wearing a mask, I would ask that they contact Jean Kramer, our COO, so that we can follow up with that particular aide or that particular agency. How can we enforce that? Honestly, Sandra, I would say that we are doing our best with the resources we have. When a private duty aide enters the building through the front door, we are telling them that they must be masked at all times. Just like our residents, just like our staff, they have to have a mask. If they don't have a mask, we are turning them away. We are absolutely not allowing anybody into the building without a mask. Now, with that being said, what happens once they get into the building is a little bit harder for us to monitor. As I said, most of the aides have been wonderful. They're using their masks when in the apartments, when moving around the building. This particular aide, I would need some additional information, and you and I can touch base offline if you'd like, regarding this kind of violation. But again, I'm a big proponent of residents here, see something, say something. It's all of our responsibility to keep our building safe, to keep our campus safe. So we really need to kind of come together as a community. As I said, they should contact myself, they should contact Esther Bodfield, our Director of Resident Services, or they can reach out directly to Jean Kramer, our Chief Operating Officer, so that we can follow up with the individual aide or with the agency that the aide may work with, because it's absolutely unacceptable for an aide or really any staff member, whether they work for Aviva or not, to be walking around the halls without a mask. We've been dealing with that with our servers. We have some amazing dedicated high schoolers who are using their time off from school to help us, continue to serve meals to residents. They struggled with understanding the masking at the beginning, but we've done a lot of in-service with them, and we're teaching them what the importance of the masking is. So I would say, it's definitely a work in progress, but, I think somebody said it best the other day. I think it was one of our board members that, the proof is in the pudding. We are really fortunate to not have any cases here on campus, and we feel that our guidelines and our procedures are really working in our favor for that reason, because we don't have any cases. So I hope that answers your question. Anything else that we can think of as we're kind of going along here? As I said, we are stockpiling supplies. We are rationing them at the moment to make sure that we have enough given a situation where we may have a COVID-19 patient. I did want to let people know that over the coming weeks, you may see the Aviva name in the papers. We are, as I said, working with that consortium of senior living facilities to kind of share some factual information on what's happening in the senior living industry and what's happening here on our campuses. We feel like there's a lot of misinformation out there right now, and we're trying really hard to kind of get the information out to the public as best we can. So if you do see our name in the paper, I don't want anybody to panic. I don't want anybody to think, we're being grouped together with COVID-19, facilities. We're really doing this as a way to kind of just spread some factual information on what it's really like in a senior living facility at the moment, and what we're doing, and how we're hoping the community will come out and support us in our efforts to do that. Sandra, it's always my pleasure. I'm happy that we can do this, and I'm hoping that I'm giving the information to the best of my ability. With some few technicalities, have to always be honest and correct myself when needed. But I hope that this information is really helpful for everyone. One of the things that I did want to address, because it was brought up in the last Facebook Live, and our Benderson families will get some more information on it on Friday, is the prevalence of hydrochloroquine, also known as Plaquenil. Plaquenil, there's been a lot of talk about Plaquenil on the news. It's an anti-malaria medication that some researchers have said could be used to treat COVID-19 patients. So as a precaution, we have brought on some Plaquenil to our storage units here on campus. But I want to really stress that the only reason why we have brought it onto campus is so that if a physician, it has to be from a physician, orders a resident to be put on Plaquenil in the case of a COVID-19 positive diagnosis, that we have it here on campus. We have read the same reports that many of you have about the terrible side effects of Plaquenil. We've also read the recent report that says that Plaquenil may actually make things worse for COVID-19 patients. So we're not planning on giving it out. We would never give out a medication unless it was unless it was prescribed by a physician. So I really, really want to stress that, because I think that that's another maybe misconception that I think some of the people in the public might have, that, we're just going to give out a medication whether or not whether or not a physician ordered it to treat a patient. That is never, ever going to happen. Plaquenil is going to be only given if a physician thinks it's medically necessary. And even then, we feel pretty strongly that there are better and safer ways to handle that. So I did want to just point that out, because I know that there is some question about Plaquenil, and there's a lot of talk on the news about it. So I hope that is helpful. Debbie, great to see you again. Great to speak with you again. Still no cases. No cases in staff, no cases in residents, nobody under investigation. I cannot stress that enough. That we do not have any COVID-19 cases at this moment, and if, God forbid, we do, I will make sure, I will do everything in my power as the communications manager here on campus to make sure that information gets out as soon as possible. Carrie, that's a great question about the podiatrist coming to campus. I know next door at Anshin and Benderson, the podiatrist is not coming to campus. Our nurses are actually handling any kind of podiatry needs. Here at Coburnick, I would have to get you more information on that, Carrie. I know that the podiatrist was coming in as of last week for limited patients, but I don't know if that process is going to continue. So far, we have been allowing our physician partners to come onto campus in Coburnick, actually in an attempt to make sure that there's less reason for our independent living residents to leave campus. But I would have to double check to get you a firm yes or no answer on Coburnick. But I do know next door we are not having the podiatrist come in. Again, a special shout out to some of our nurses. I know they have been doing some great work for residents who need podiatry work. Okay, great, Carrie. So yeah, as of right now, the podiatrist is not coming onto campus, and our nurses are handling those podiatry needs. So hopefully that answers that question. And if you ever need a list of physicians that are or are not coming on campus, or you have questions specifically about, physicians, treating patients or anything like that, especially with your dad, Dr. Morrison is still coming to campus. Absolutely. Dr. Morrison has dedicated himself to coming onto our campus to see patients, things like that. So, he has been with our campus for a very long time. We are so fortunate to have him. He's seeing patients in both buildings, again, in an attempt to limit the need to leave campus. But specific specialists like podiatry, our hearing specialists, things like that, I would need to kind of check a little bit further. I know, as I said, last week the podiatrist was not coming onto campus. But if you have any questions about, specifically, Carrie, your dad and any kind of care he may need from physicians outside coming to Anshin, I would really recommend reaching out to Amy Jackson, our administrator over at Anshin, so that she can specifically give you answers. Or if you have a need for dad to be seen by anybody, then Amy can help arrange that. So I hope that helps. As I said, we are really trying to limit the need for residents to leave campus, as well as people from the outside to coming into campus. I agree, Carrie. Dr. Morrison is really a wonderful, wonderful physician, and we are so, so thankful to have him. So, with that, I just wanted to kind of open it up again to any questions, any concerns anybody is having, whether it's related to campus, whether it's related to COVID-19 in general, any kind of guidelines that may have been released that you'd like some clarification on. I really want to stress that Aviva not only wants to, of course, care and protect our residents, but we really want to be a resource to families as well. Your health is just as important to us, just as important to us as our residents. So I really, really mean that. Thank you, Sandra. We really appreciate the gratitude. It's definitely not the easiest thing to do every day, and I'm sure our staff is experiencing the feeling of, kind of that burnout that comes out to it. But we have some great stuff planned for our staff, some great moments. Tomorrow we are having a costume day for our staff. I personally am very excited to come in my costume. I'm keeping my fingers crossed that I'm going to win that big prize. But I know last week we did a sport jersey day and people got very competitive about it. College football is kind of sacred here on campus. I don't understand it. I'm a Northeast boy myself, so I think it's more of a Southern thing. But we are really trying hard to keep our staff motivated, and I cannot thank all of our staff members enough for the amazing, amazing work they're doing, and the dedication and passion. I have to say, just walking through the halls here on campus, even in the midst of this crisis, you still hear the laughter, you still hear the joy. It's still Aviva. It is still our campus. We're still that big, crazy family. I always like to tell families when they have residents move in, you're part of the family now, whether you like it or not. Jane, thank you so much. Can we contribute to a special treat of some sort for the staff? I really appreciate that. What we're asking for right now is that you just hold off on doing that until we can safely allow people back on campus. So that we can, do it in a way that's safe and secure. So I really appreciate that. I definitely think we're going to have more details once we can slowly start to reopen campus about a way to kind of give back to the staff. So I would say just stay tuned and thank you for all that positivity and, for wanting to treat our staff to something special. So, at the moment we're treating them with, treats and ice creams and things like that. But I would say as we get through more of this health emergency, we can release some details on how to to thank the staff. So I would just ask for your patience right now until we feel that it's safe to do so. So looking at the time, it's about 10:45, so I can take one or two more questions if anybody has any. If not, I think we can sign off for this week. Just so everybody knows in terms of our communication schedule, on April 30th, we are currently planning for Jay, again, our CEO and president, to do his second State of Campus report. As we did last time, I will live stream it on Facebook, as well as save the video here on Facebook. Jay's just going to give his report on where he sees campus going. And then in terms of another Facebook Live, I think I'm going to keep it to this schedule, which is about every other week. So that way that, people can get their questions answered. I do want to kind of make an announcement that's not necessarily directly related to COVID, but is also related to COVID. You're going to start seeing on our Facebook advertisements and messages regarding the Giving Challenge. The Giving Challenge is a really amazing opportunity, and we really, really do ask that if you're interested in kind of giving back to our community, that you participate in the Giving Challenge. So what the Giving Challenge is, it's a virtual day of giving. So it starts at noon on April 28th and runs till noon on April 29th. The Giving Challenge is sponsored by the Community Foundation of Sarasota. And what's really amazing about the Giving Challenge is that every dollar up to $100 is going to be matched by the Patterson Foundation. And what we are raising money for this year is our emergency COVID-19 response fund. So that fund directly pays for things like personal protective equipment, sanitization equipment, various activities for our residents, updated communications equipment so that we can do some additional programming. So that fund is really, really important. That's where our funding is coming from to fight COVID-19. So I would really encourage everybody to take a look at it and participate if you can. You can get more information by going to givingpartnerchallenge.org. Or if you just go back to our main Facebook page, you'll see some flyers and things like that over the next few days. So I really would ask, for everyone's generosity. if you can donate on Tuesday and Wednesday of next week. It's a really great opportunity to make any size donation really count for something substantial. So you'll definitely see a lot of information about our COVID emergency fund, and that's really where we're focusing our fundraising efforts right now, to just so we can ensure that we can continue to fight COVID-19 to the best of our ability through purchases of equipment. So with that, I think that's a great place to kind of sign off for today. I do apologize if I was stumbling at all. The technical difficulties this morning kind of threw me off. So I also apologize for being late, but I hope it was as informative as the first one. Please know that you can always email me to ask a question or to address any kind of concern you may have. Again, my email is going to be M as in Matthew, last name Solomon, SOLOMON, at avivaseniorlife.org. So that, again, that's just going to be M as in Matthew and then my last name. And we're really here to help. And please don't think that you need to reach out to us just to talk about a resident or just to address a concern. If you yourself have any concern or need a resource while dealing with this, please, please reach out to us. So thank you all for so much of the positive feedback. I really enjoy being able to connect with so many families. This has been such a pleasure. Such a pleasure to get to know so many of our families. I guess that's the silver lining of this. So thank you all. Stay safe, stay home, and best of luck, and everybody enjoy your weekend. So, all right, all. Have a good day, and again, be safe.